So what are the signs of infertility in a female? Well, I know you're wondering, Corlandos, why are you talking about this? And it's because I'm not going to try to give you some deep medical definition. I'm going to approach it from a little bit of a different angle. So stick around. What's up? I'm Corlandos Scott, and I am a surrogacy, assisted reproduction, egg donation, sperm donation attorney based out of Los Angeles. So that means my practice revolves around helping people grow their family through assisted reproductive technologies like sperm donation, egg donation, surrogacy, and all that good stuff. And if you're here, you're probably wondering about the signs of infertility in a female. Well, we're going to talk about that. I'll give you just a broad swath of what we know to be things that affect fertility, but I want to also cover it from a different angle. So let's dive right in. Now, I'll go ahead and give you a spoiler. I'm going to talk about assisted reproductive technologies. Surprise! But the reason that I'm going to talk about it is because when we're discussing issues around infertility, assisted reproduction is an answer to those challenges. So ART, or assisted reproductive technologies as we call them, they really take that period away from infertility at the end of the sentence, you can't have a baby, and it replaces it with a question mark, which is, how can you grow your family, or how can you have a baby? So that's the answer that ART, or assisted reproductive technologies, offers. But let's look at some general causes for infertility, or some general signs, I should say, around what is expected when we're talking about infertility in females. So here are some of the normal signs that you would typically see. When we're looking at signs of infertility, we see things like abnormal periods. If that's something that's occurring over an extended period or occurring regularly, that's something you definitely want to go see your medical provider about. If there are situations where there's bleeding that's heavier or lighter than usual, that's also something that should trigger you to go talk to your OB or to go see a reproductive endocrinologist. And I know a lot of times a lighter period than normal could possibly be a cause for cheer, but it's also something that you need to monitor and make sure of that you're keeping an eye on anything that deviates from what's normal. Another thing to look out for when we're talking about signs of potential infertility issues is irregular periods. And what I mean by that is the number of days in between each period varies each month. Now, you know your body better than anyone, so you would probably know exactly when you would typically expect to see a cycle come on. So when you see any variation in that over an extended period of time, that should trigger in your mind, I may need to speak with somebody to make sure things are okay. And I'm talking about times when cycles also are either too long or too short. Again, nobody knows your body like you, but you should always keep an idea. And it doesn't hurt to even have a journal, especially if you're in a moment in your life where you're trying to conceive or you're working towards growing your family. Another sign to look out for is painful periods. Of course, there is some discomfort associated with every cycle. However, you always want to make sure that you're looking again for deviations. So if you normally have a pretty pain-free cycle, then if you're experiencing pain, that should be a sign. If you normally have a cycle that's accompanied with some level of discomfort, keep an eye on whether that level of discomfort rises or falls. Also, if your cycle is accompanied by any back pain or pelvic pain or cramping, you want to make sure you keep an eye out for these signs. The next sign is no period. Either you've had a period or the periods suddenly stop, especially when you're not menopausal or even premenopausal yet. That should also be a sign that you want to go speak with your medical provider to get answers to what may or may not be happening. Most of these signs are things that you want to catch as early as possible, especially if you're trying to conceive for yourself. Oftentimes, the earlier we catch these issues, the better and easier it is to cope with them and to address them on the medical side of things. At the end of the day, listen to your body. Don't just Google for answers. What I'm trying to say here is make sure you go see a doctor, an OBGYN, a reproductive endocrinologist, some type of fertility specialist that you can confide in and let them know what you're experiencing, and make sure to tell your doctor of everything, even the slightest changes or symptoms that you noticed, and also when those symptoms started. that start time is oftentimes very crucial in them being able to make a prognosis for what's going on with you. Speaking of listening to things like your body, I want to listen to you. I want to know what you think about not only this video, but the entire channel. So do me a favor, if you're not already subscribed, go ahead and just click that little subscribe button and click the little notification bell so you know whenever I release new videos. And while you're down there, go ahead and leave a comment. Let me know what you think about the channel. Also, let me know if you have some advice that you can pass along to someone else who may be going through infertility now, or if you have questions, it's also a great place to drop those questions. I'll be sure to answer as many of them as I can in videos, but I'll definitely respond to the comments. Now let's get back to it. So that's just a broad overview of some of the signs that you can use to look for to be telltale markers of if you may be challenged with infertility or about to be challenged with infertility. But where do I come into all this whole topic of infertility? Well, as an assisted reproductive technologies attorney. And like I said earlier, ART, or Assisted Reproductive Technologies, provides you with several options. So how do I play into all this, and why am I even talking about it? Well, because like I said, I'm an assisted reproductive technologies attorney. And the reason why I love what I do is because in my job, there is no period after infertility. No pun intended. There's no period, I say that because ART, or Assisted Reproductive Technologies, provides you with several options for defeating infertility. Here's just a few of them. Egg donation. If your problem is producing quality eggs, you have the option to go through an egg donation cycle where there are a number of women who are willing to donate eggs to a potential or hopeful parent or parents who are trying to grow their family, but the problem is they don't have a viable source or a source for viable eggs. Next, we have embryo donation. And I know you probably already know what that is, but in case you don't know what an embryo is, that's when sperm meets egg, and a few days later, we have an embryo. Embryo donation is where people who have gone through the process of IVF or some other form of assisted reproduction, they may have remaining embryos that are frozen that they don't intend to use to grow their family. They want to help someone else grow their family. And you can find people who are willing to donate embryos. You can even find clinics that specialize in getting donated embryos to you. If you're curious about the embryo donation process, make sure you go up and click on my video about embryo donation and how that process works. And last but not least, we have the star of the show, surrogacy. And surrogacy is a use case for when your condition keeps you from getting pregnant or staying pregnant, but you already have eggs or sperm or embryos created using either your own eggs or donated eggs, combined with the sperm of a spouse, a partner, or a sperm donor. When that's the case, you can use those embryos to transfer the embryos to the uterus of a gestational carrier, commonly called a surrogate, who's willing to carry that pregnancy for you and deliver the baby on your behalf. And that's what I get the absolute pleasure of doing every day, all day for my clients, is helping them navigate the processes of egg donation, embryo donation, surrogacy, so that they can grow their family and they don't let infertility stop their lives. Speaking of surrogacy, if you're interested in growing your family through surrogacy and you're wondering where the heck do I start, I've got something for you. It's my free gift to you. It's called the Surrogacy Roadmap, and you can get it by clicking the link in the description box below. But it's a 30,000-foot view of all of the process of surrogacy from beginning to end and all the steps in between. Once you get your hands on that roadmap, you'll have a good idea of exactly where you should start and where you should go next. So be sure to click it, and I'll see you in the next episode.